Have you been suffering from low back pain for so long and you don't know where to begin to target and find the root of your problem? If you've been suffering from one side weakness or stiffness, tightness, compensation, and you don't know where to begin. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be demonstrating proper breath work and learn to find the cause of the root of your problem, as I will cordially invite each one of you of my upcoming free 6-part video series about my core back protocol that I'll be reopening my back masterclass on September 1st. So if you want to access and start regaining life without back pain to have a stronger core and improve posture, click the link on the description below. Write your name and email address. Be part of the early bird waitlist for first come first serve basis as I reopen it to exclusive contents and learn from basics. With 20 years experience as a physical therapist, and I have helped thousands of my patients online and in my clinic. So in this video, it's important to start engaging your core muscles and learn more about what is lumbopelvic hip complex or the core. And once you find out how to engage through proper breath work, especially if you're having spasm, tightness, and you don't know how to relax all of these muscles, then this is the beginning part. I know this is an introduction, but be prepared practicing this proper breath work so that on August 20, as I will release my very first video about my core back protocol, where I'm going to show you what is neutral spine and how to target if you have a lateral pelvic tilt, because I've seen a lot of my patients with one-sided weakness, and the area where they have pain, tightness, stiffness is usually lower than the opposite side, which is very tight as well because you've been leaning away from the weaker side. And that's where we're gonna do a proper assessment tool. Once you find out the pelvic alignment, once you find out that you are having this misalignment, then you know how to start right now and fixing your back pain for good. So in this video, you can do this in lying on your back or in seated position. Let's begin in seated position, and then we're also going to do in a lying position and all fours to relieve the compression on your back. So in the seated position, place your hand on your abdomen. You can place one hand on your abdomen and one on your low back. You're gonna feel how to properly breathe, and then you're gonna expand your rib cage from laterally. So one hand a little bit more back posteriorly and side. So I'm placing one hand on my right rib cage and one on my abdomen. I want to make sure I'm not breathing through my neck. I'm not lifting my shoulder when I breathe. I want to make sure I'm really expanding my belly. But of course, most of my colleagues believe take a deep breath only, and most of my patients with back pain, they think it's going to be lifting their chest up and you're taking a deep breath. You know, when you see your doctor, when they place the stethoscopes on their chest and they want to take them some deep breaths, they ended up really expanding through their chest. And then this is opposite. We're just going to keep our shoulder down. One hand here, one hand here on the side. As you breathe in, I'm not moving my chest. I'm not moving my shoulders. I'm just expanding my belly. I'm going to feel a little bit expansion on the side here and posteriorly. And then as I breathe out, I want to make sure I breathe out through my mouth so I could really purse lip, make a purse on your lip. Open slowly and exhale. Slowly release the air. And as you do that, you're going to do a gentle lift from your lower part of your abdominal muscles, your pelvic floor, as you breathe out. Imagine if you want to zip up a tight jean from your lower abs. You don't want the zipper getting stuck on your skin. And you breathe out. Again, breathe in, breathe out. Last deep breath in and breathe out. While keeping my back in neutral position, I'm not tilting my back. I'm not doing any pelvic tilts, keeping everything in the same position. And now let's try checking our spine and our breath work lying on your back. And that's why I'm doing this video, to prepare for August 20 so that you're ready, prepared when we start moving our body. You don't want to be having difficulty engaging your core with movement on your legs and on arms. And you want to make sure you're doing a beautiful flow of simultaneous breathing, breathe out with movement. So as you inhale now, one hand on your abdomen, one hand on your side. And then zip it up and breathe out. I'm not tilting my pelvis. I'm going to place one hand at the small of the back, making sure they are in neutral position as I breathe in. And then breathe out. Really releasing the air. You're going to feel a little bit ache where you have pain. It could be one side or across your back, and really feel that gentle pressure. Because when you exhale and squeeze everything here, sometimes if you have inflammation in your back, it gently irritates it, but as long as it's not excruciating pain, that's fine. Last deep breath in, expand, and you can really see my abdominal muscle rising, and then my rib cage rising on the side, and then breathe out. Slow and steady. I'm not breathing out quickly like this. I want slow, controlled mindfulness, and breathe out. And now, as I said, keep practicing this breath work. And today, we're gonna do some gentle movements on our lower body to help engage your lower abs and your hip flexors, because this area are usually very weak and tight if you're having back pain. So as you breathe in, exhale, breathe out. I'm slowly lifting my heels. So if you notice, I'm exerting effort. I'm lifting my heels and I'm squeezing my core. My lower abs going up to my navel, not from the top going down, but the opposite. You don't want a downward pressure towards your pelvic floor. You want a lift as you breathe out. And then as you slowly lower your heels down, that's when I take a deep breath again. So this is the simultaneous movements I was talking about earlier. So as I lift my heels, I'm breathing out, I'm contracting my core in, zipping up from my lower abs to my navel, breathe in, lower my heels down, and then expanding my belly, and breathe out and lift. One hand at the small of my back, keeping that neutral spine. Breathe in and breathe out. Well done. So after doing that, lying your back, let's engage our core in all fours position. So when you're on all fours position, it helps already engage your core in a different way. Making sure your hands are level to your shoulders, knees level to your hips, and keeping your back straight. As you breathe in, I'm really pushing through my belly, expanding my rib cage. This helps decompress your tight lumbar spine all the way to your thoracic and even your cervical spine. And exhale, squeeze my core and zip it up and breathe out. If you notice, I'm not tilting my pelvis. I'm keeping it stable. Learning how to take deep breaths. Breathe in, expand, exhale, zip up. Four more deep breaths in. Three more. Inhale. Last deep breath in. Exhale. And that's it. I'm hoping you enjoyed this gentle breathing exercises with me in different positions, and that's why I'm here to guide you safely and effectively if you're having back pain. I'm hoping you're feeling a little bit relief right now. It feels good, right? Just taking deep breaths, decompress. Taking those breaths help realign, relax those muscles, reset from your nervous system, because usually the spasm, stiffness, and tightness is from our back signaling to our brain, and it keeps firing to keep that tightness to be in the protective mode. And that's why breath work really helps. And if you want to join my upcoming free 6-part video series, you are going to receive video 1. Day 1 will start August 20, 2024. And don't miss out. Mark it on your calendar. Write your name and email address down below. And be on the lookout on my email so you can receive directly the video before everyone sees it inside my YouTube channel. And you can also receive the next video 2 days later. And that's why this breathwork is so important, because in video 1, we are going to learn how to engage your core with movement and keeping your spine in neutral position. On top of that, we are also going to utilize some beautiful equipment. And on video 1, we are going to already start beginning how to use the ball. It's a little bit more progressive, my core back protocol this time, so that when you decide to join my back masterclass on September 1st, you are ready to tackle. But it's absolute beginners. Everything is only 8 to 15 minute workout that we're going to resolve your back pain for good, and you're going to be guided by me to find out what's the root of your problem. Because once you know the root of the problem, everything goes in place and you know what's the best solution for your back pain needs. Fix it for good to have a stronger core, improve posture, and regain life without back pain. So I'll see you on my next video training. Always remember, be safe, be well, and healthier you. If you have more time today, learn more about dead butt syndrome if you've been sitting a lot, and watch this amazing video about quadratus lumborum pain. See you in my next video training. Bye!